Out to discuss this rare form of cancer that he had is Dr. Shikha Jain. She's an assistant professor of medicine and director of communication strategies and medicine at the University of Illinois, Chicago. Dr. Jain, welcome to BNC. Appreciate you being with us. This cancer, was it rare? Can you tell us about it?
Yeah, thanks so much for having me, Laverne. It is so sad that we lost such a visionary fashion, really giant in the field, and we all mourn his loss. Cardiac angiosarcoma is what he was diagnosed with, and it is an extremely rare form of cancer. Angiosarcomas in general are typically found in less than 1 in a million individuals. And then when you talk about cardiac, meaning it was found primarily in the heart, it's even more rare. So it's a very rare cancer, and it's so sad that at such a young age he was diagnosed and eventually, unfortunately, succumbed to the cancer.
So, Dr. Jain, we don't know much because they say he was battling it quietly. We know he was 41, that's pretty young. He must have been able to hide it without looking sickly, for lack of a better word there. But how does that work then? Like, how did people not know that he was near death, or do you just not know? I mean, what can you look out for somebody so that they can get an early diagnosis, or is it something that just can go undetected?
So, the challenge with this particular type of cancer is it can often present with very non-specific symptoms. So, you might have a cough or some shortness of breath. You might notice some swelling in your legs if the tumor is blocking blood flow from your heart to the rest of your body or return of blood flow. There's a lot of not very exciting symptoms that people might see that often result in this cancer being diagnosed at a much later stage than some other cancers typically are diagnosed at, where you're more likely to see like a lesion or a mass or specific symptoms. So this type of cancer is very difficult to diagnose. And then to answer your question about how he might have been undergoing treatment for 2 years without people knowing, many cancer patients have surgeries or have chemotherapy or radiation. And many times their friends and family don't know that they are going through the treatments they're going through because they're able to live their life, they're able to navigate their life, they're able to continue doing what they're doing and make certain accommodations or make excuses for maybe they're a little bit too tired or they're coughing more than usual or they need to sit down more than usual. So a lot of times, especially people who navigate these cancer journeys more privately, people are able to kind of hide or explain away certain symptoms and certain things that they're experiencing as they go through the treatments that they need to treat their cancer.
Is there somewhere in particular that treats this type of cancer that is well known for it? I'm not sure about the work you're doing there, where people could go if they can't really figure out what they have, but they may suspect it's this.
So, anybody who is thinking they might have this type of diagnosis, the best place for you to go is an academic center. So, an institution that is affiliated with the university or someplace like the Mayo Clinic, University of Illinois, where I work. We have experts in these types of fields who see this cancer. Because it is so rare, a lot of times it's not diagnosed because, again, people may not know the symptoms to look out for. So, if you have a family history, for example, if somebody in your family has had an early diagnosis of a type of cancer, you may need genetic testing. So you may need to make sure that you don't need to be screened. You might have an uncle or an aunt who died at a very young age from some cancer, and you may not know what it is. So make sure you mention that to your doctor so they can do genetic testing or they can at least talk to you more, find out your history. And then I'd recommend, if you are diagnosed with a type of cancer that is very rare, like this type of sarcoma, I recommend you being seen in an academic setting where they see those types of cancers
Thank you,
more
Dr.
often
Jane.
than sometimes other areas.
Appreciate your time.